I'm sorry, Mr. Smith, but it looks like you have a bulging disc in your spine. A lot of people hear that phrase and they think that they're falling apart, whether it's the phrase bulging disc, herniated disc, slip disc, degenerative disc disease. People think it's almost like a death sentence, like now they're never going to be the same again. That's not necessarily true. As a matter of fact, most of the time that's not true. If you do an MRI on anybody off the street, about 80% of people will have a disc injury somewhere in their spine, and most of them won't even know it because they're not symptomatic, they're not having pain. It's not until those pain symptoms show up that people go to the doctor and get checked and they find that they do have a disc injury. Now, much like arthritis, I have seen, actually, I will tell you a story about a patient. The worst disc injury that I have ever seen was in a young gentleman, and he had almost no pain symptoms. He had a little bit of back pain, a little bit of like traveling pain down his leg, and we ended up doing some imaging, and he had a significant disc injury. So I'll show you what that looks like. So in your spine, you've got bones separated by discs. They're kind of like jelly donuts. This is a perfect disc. So notice that you've got an outer material here. It's a little bit harder. You've got softer material on the interior, and this is basically used to absorb shock, help your joints to move within your spine, right, and support your spinal column. If you have damage to your disc, so again, this could be anything from a bulging disc, which would be just a tiny little protrusion of the disc material into the space where the nerves are exiting. You can have a herniation, or you can have degenerative disc disease, where really the disc is like very, very compressed. But if this happens, you'll start to see the jelly material kind of ooze out through these harder fibers, and then you can get it compressing a nerve here. So in the patient I was just mentioning, he had not only nerve compression, but he had actually spinal cord compression, which is really bad. So that's the worst case scenario, and that would be, most of the time, that would be pretty inclusively a surgical case. But that is not what most of us have when we talk about having a disc bulge or a disc injury. And most of us, it looks kind of like this. So we just have a little bit of damage to the discs, and that can happen throughout life, repetitive activities. It can happen due to improper lifting, improper movements, especially twisting and lifting injuries. But most of the time, these are pretty stable, and they can be managed very, very well conservatively by getting different types of therapies, doing home exercises, stretches as appropriate. So why does the disc actually end up causing pain? Well, like I mentioned, you can get compression of the nerves. So the nerves can be very sensitive to direct compression or inflammation, and that can cause your brain to sense those pain symptoms. What can also happen, as I mentioned in my patient, is you can get spinal cord compression. In those cases, the reason that that is a surgical case is because you can end up getting numbness, weakness, tingling down through your lower extremities, through your buttocks, legs, feet, and it can actually also, in severe cases, affect things like bowel and bladder function. So again, if you start to have those types of symptoms, that's certainly an emergency condition that you want to get checked out pretty immediately. Again, not most of the cases, but that is something that can happen. So the good news is, again, that if you get a disc injury diagnosis, now your practitioner can decide what the course of treatment will be. And again, oftentimes you're going to probably respond pretty well to care. One of the key things is going to be pain-free movement. So making sure that you're keeping your body moving, that can help to rehydrate the discs. It can, again, open up those joint spaces so that you're getting pressure and irritation off the nerves. You want to, as much as possible, avoid being stationary, sitting for prolonged periods of time, laying down for prolonged periods of time beyond what you would do to like sleep and just kind of your normal routine throughout the day. And then again, if symptoms continue to get worse, if you do start to have that progressive symptom of maybe pain, numbness, weakness, tingling down the legs, things like sciatica, you probably want to get that checked out and make sure that you're still on the right track with healing and that you don't end up with those progressive types of symptoms. So hopefully that helps explain a little bit better what actually is going on when you have a disc injury. Let me know in the comments if you have any other questions. And if you did get some value out of this video, leave me a thumbs up and let me know.